Depression, a comprehensive overview. Introduction. Depression is a complex and pervasive mental health disorder that affects millions of people worldwide. It is characterized by persistent feelings of sadness, hopelessness, and a loss of interest or pleasure in daily activities. Far more than just feeling blue or experiencing temporary sadness, depression is a serious condition that can significantly impact a person's quality of life, relationships, work performance, and overall well-being. The World Health Organization, WHO, estimates that more than 264 million people globally suffer from depression, making it one of the leading causes of disability worldwide. Despite its prevalence, depression remains widely misunderstood and stigmatized, often preventing those affected from seeking the help they need. This comprehensive exploration of depression aims to shed light on its various aspects, from its causes and symptoms to treatment options and coping strategies. By understanding depression more deeply, we can work towards better recognition, support, and management of this challenging condition. Understanding depression. 1.1 Definition and classification. Depression, clinically known as major depressive disorder, MDD, is a mood disorder characterized by persistent feelings of sadness, emptiness, or hopelessness, often accompanied by a range of emotional, cognitive, and physical symptoms. It is classified in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, under mood disorders. While everyone experiences occasional sadness or low moods, clinical depression is distinguished by its persistence, intensity, and impact on daily functioning. To be diagnosed with MDD, symptoms must be present for at least 2 weeks and represent a change from previous functioning. 1.2 Types of depression. Depression manifests in various forms, each with its unique characteristics. A. Major depressive disorder, MDD, the most common form, characterized by persistent low mood and loss of interest in activities. B. Persistent depressive disorder, dysthymia, a chronic form of depression lasting for at least 2 years. C. Bipolar disorder, involves alternating periods of depression and mania or hypomania. D. Seasonal affective disorder, sad depression that occurs in a seasonal pattern, typically during winter months. E. Postpartum depression, occurs in women following childbirth. F. Psychotic depression, severe depression accompanied by psychotic symptoms like delusions or hallucinations. G. Premenstrual dysphoric disorder, PMDD, severe mood symptoms occurring in the week before menstruation. 1.3 Prevalence and demographics. Depression affects people of all ages, genders, and backgrounds, but certain demographic factors influence its prevalence. Gender, women are about twice as likely as men to experience depression. Age, while it can occur at any age, the first onset of depression often occurs in the late teens to mid-20s. Socioeconomic status, those living in poverty or experiencing financial stress are at higher risk. Chronic illness, people with chronic health conditions are more susceptible to depression. Causes and risk factors. The etiology of depression is complex and multifaceted, involving an interplay of biological, psychological, and environmental factors. 2.1 Biological factors. A. Genetics. Studies suggest that depression can run in families, indicating a genetic component. However, having a family history doesn't guarantee an individual will develop depression. B. Brain chemistry. Imbalances in neurotransmitters, particularly serotonin, norepinephrine, and dopamine, are associated with depression. C. Hormonal changes. Fluctuations in hormones, such as those occurring during pregnancy, postpartum, menopause, or thyroid problems, can trigger depressive episodes. D. Chronic medical conditions. Certain illnesses like cancer, heart disease, or chronic pain can increase the risk of depression. 2.2 Psychological factors. A. Personality. Certain personality traits, such as low self-esteem, pessimism, or being overly self-critical, may increase vulnerability to depression. B. Trauma. Experiencing traumatic events, especially in childhood, can heighten the risk of developing depression later in life. C. Stress. Prolonged or intense stress can overwhelm coping mechanisms and lead to depression. D. Cognitive patterns. Negative thought patterns and cognitive distortions can contribute to unmaintained depressive states. 2.3 Environmental factors. A. Life events, significant life changes or losses, such as divorce, job loss, or death of a loved one, can trigger depression. B. Social isolation, lack of social support and feelings of loneliness can contribute to depressive symptoms. C. Substance abuse, alcohol or drug abuse can both cause and exacerbate depression. D. Socioeconomic factors, poverty, unemployment, and lack of access to resources can increase the risk of depression. This concludes the first part of our exploration of depression, covering the introduction, types, prevalence, and causes. Would you like me to continue with the next section, which will cover symptoms and diagnosis? Or do you have any specific aspects you'd like me to focus on or expand upon?